Cuba recently sent over 200 doctors to South Africa to help combat the pandemic. But according to U.S. Secretary of State Mike Pompeo, the only reason they're doing this is to make money for the Cuban government. What's going on? Let's discuss. I'll talk about another story involving doctors in Cuba that might make you sick to your stomach. On April 26, the BBC posted this article about doctors arriving in South Africa. They are among 1,200 healthcare workers sent to battle COVID-19 in 22 countries that have requested help from the communist state. Cuba, with 1,337 recorded cases of COVID-19 and 51 deaths, has the world's highest ratio of doctors to population and began preparing for the virus early. According to Reuters news agency, it is renowned for its focus on prevention and community-oriented primary health care to fight epidemics. Cuba started sending doctors to help with the current pandemic in Italy on March 21st. The Caribbean island has sent its armies of white robes to disaster sites around the world, largely in poor countries since its 1959 revolution. Its doctors were in the front lines in the fight against cholera in Haiti and against Ebola in West Africa in the 2010s. Then just yesterday, on April 30th, a man from Texas fired several rounds from an assault weapon into the Cuban embassy in Washington, D.C. The act is being considered a hate crime. And then today, on March 1st, Pompeo, without any mention of the attack on the embassy, warned in this tweet about the use of Cuban doctors abroad as a tool of the communist government.
We've noticed how the regime in Havana has taken advantage of the COVID-19 pandemic to continue its exploitation of Cuban medical workers. We applaud leaders in Brazil and in Ecuador and Bolivia and other countries which have refused to turn a blind eye to these abuses by the Cuban regime, and ask all countries to do the same, including places like South Africa and Qatar. We must protect our medical workers now more than ever. Governments accepting Cuban doctors must pay them directly. Otherwise, when they pay the regime, they are helping the Cuban government turn a profit on human trafficking.
3 hours later, the State Department tweeted a link to this article by Share America, which on the About Us page of their website states, Share America is the U.S. Department of State's platform for communicating American foreign policy worldwide. We share compelling stories and images that spark discussion and debate on important topics like religious freedom, rule of law, economic prosperity, human dignity, and sovereignty. Right away from the description, they say that they share stories. And stories are not facts. The story they share about the Cuban doctors has no links to any actual facts or articles, nor does it argue for any potential benefits of the doctors' efforts. You would think that the State Department would be able to provide one pie chart or one graph or one document showing any kind of proof of their accusations, but they do not. Instead, they publish these two cartoons and credit the artist D. Thompson as working for the State Department. They also provide one quote from an employee of the State Department. According to witness testimony of Cuban doctors who have escaped, many doctors, often under pressure, double as foreign agents who incite violence and involve themselves in political coercion, Filippetti said, and stating that in recent years Cuban doctors have threatened to withhold treatment from Venezuelan patients if they didn't vote for Maduro, been connected to inciting violent protests in Bolivia, falsified data for the political and economic benefit of Maduro's regimes. That, Filippetti said, is why Brazil, Bolivia, and Ecuador, among other nations, have stopped using Cuban doctors. In late January, according to the Washington Post, the U.S. was urging allies to cancel their health cooperation agreements and send their Cuban doctors packing. Also, according to the Post, in this April 10th article, some countries might want those doctors back. When they left, there were no specialists to replace them, says Ricardo Ramirez, a retired physician in Ecuador's hard-hit city of Guayaquil and head of a regional anti-corruption commission. It's one important factor why we can't provide an adequate response to the virus now. If the Cuban Medical Brigade were still in Bolivia, there would be better management of coronavirus, said Maria Bolivia Roth, a head official under Morales. Why? She asked. Because the Cuban doctors always went where no one else would. So what do you think? Are Cuban doctors abroad victims of human trafficking? Is it a last resort for income by Cuba, a country hit with decades of sanctions by the United States? And why no mention of the attack on the embassy? Now I want to shift gears and talk about some doctors back in mainland Cuba. Doctors at the U.S. military base at Guantanamo Bay. Well, this year, judges have scheduled a record 215 days of military commission hearings in war crimes cases at the Expeditionary Legal Complex, the national security court that is built on an abandoned airfield with a moldy trailer park for the troops and a crude tent city for the reporters and other observers. Here at Guantanamo Bay, where the judge is hearing testimony in a pretrial hearing to decide, among other things, whether the defendants in the September 11th case were tortured. The proceedings are also putting a spotlight on the role of doctors who worked as medical officers in the intelligence agency's overseas prison program. As part of the pretrial discovery, recently unclassified documents titled Summary and Reflections of Chief of Medical Services on OMS Participation in the RDI Program explain how doctors were used to keep patients alive during the CIA's rendition, detention, and interrogation program at Guantanamo Bay and other prisons after 9/11. The doctor's stated role was to monitor the health of the detainee. He also kept count of each near drowning. The physicians were present in interrogations that were harmful and life-threatening, and that violates the first principle of medical ethics. First, do no harm. During testimony Monday, Dr. Mitchell said a board-certified physician was in the room for every session of waterboarding and monitored Mr. Muhammad's oxygen saturation level through a device on his finger, a pulse oximeter. Dr. Mitchell said he held a torn T-shirt over the prisoner's nose and mouth for each one of the 183 instances of waterboarding, all carried out by him and his partner in developing the CIA's interrogation program, John Bruce Jessen. So what have we learned? Cuban doctors, allegedly as a tool of the communist government of Cuba, have helped thousands of people around the world fight illness and disease. And in Cuba itself, doctors from the United States, working for the CIA, kept people alive so they could be repeatedly tortured. If you enjoy this content, please click the like button and share, and consider subscribing for more videos. Thank you.